So heart disease is not simply heart disease. It's a heart and blood vessel disease. To make it simple, I'll divide it into three portions: the brain, the heart, and the lower blood vessels. In the brain, if the blood vessels are affected because of diabetes, it leads to strokes. In the heart, if the blood vessels are affected, it causes a heart attack, which damages the wall of the heart and can lead to heart failure, which is another added issue and problem. If the blood vessels of the lower legs are affected, that can lead to ulcers, which can then ultimately lead to amputations. Diabetes is essentially high blood sugars running in the blood vessels, which leads to stickiness of the blood. That can lead to clogging of those blood vessels or clotting of these blood vessels. More importantly, diabetes patients have things such as high blood pressure, which independently damages the blood vessel wall. On top of that, if patients are smoking, that causes thickening of the blood, which leads to more clotting. And the damaged walls of the blood vessels from high blood pressure and diabetes leads to further clotting. The most important part to consider in diabetes patients is the bad cholesterol, or LDL, which can then grow in the walls of the blood vessels, which are already sticky and have got increased risk of clotting, that ultimately blocks the blood vessels, especially in the brain and in the heart and in the lower blood vessels, which ultimately leads to the complications that we talked about, including a heart attack, stroke, and amputations. At ICLDC, we make sure that we look at every aspect and risk factors of diabetes, including managing the high blood sugars, lowering the bad cholesterol, controlling the blood pressure, and supporting patients to stop smoking.